If you had a magic wand to make the world more heart healthy, what would you do?
Well, it's a very important question.
If I had a magic wand, I would take the sense of urgency that we had with COVID and apply it to cardiovascular disease.
And the sense of urgency has been missing for decades.
Get rid of pollution at its source.
Reduce the temptations, the food we eat, the lack of physical activity, smoking.
I would give every person in the world a great primary health care system and primary health care provider to work with.
I would say lifestyle. It's about starting from early to develop lifestyles that promote a healthy heart, healthy society, and a happy citizen.
Physical activity is one way to start.
I would elevate children in the conversation. Children are the agents of change. They will change it in their parents and in their communities.
My magic wand would make it accessible and easy for people to be heart healthy.
That every person everywhere had equal access to health care.
O acesso das pessoas aos cuidados na atenção primária.
To have access to what is the current innovation, what is the current methods that we have to treat disease.
Access to nutrition, access to medication.
Everyone having access to a local park, because the parks are places that people will meet, so we'll address mental health. Parks are places where people can play and recreate and engage in sport, so people will be healthy and active. And parks are good for the environment, so we can reduce air pollution.
We need to think about these problems differently. And I'm a huge believer that digital transformation and innovation is going to be the way that we scale some of our large problems.
Communicating the importance of prevention.
Prevention, prevention, and more prevention.
Defining the best way to approach that patient and treat that patient.
If I had a wand,
I would change the policymakers' views and pass policies that are going to protect our populations from the risk factors.
Get all the players into one room, throw away the key, and tell them that we are not going to get you out of this place until you agree to work together.
And getting the health system to respond to the need of the people living with those diseases.
And I think if we work together, we can be just as effective as we were with COVID.
That we could all live longer, healthier lives, free of disease.